Hi, I'm Dr. George Volpe of New England Plastic Surgical Associates. Silicone gel-filled breast implants versus saline-filled implants. Is one better? When should one be used? These are questions that are tough to answer because there's no right answer. Let's first go over the definition between the two. So breast implants are made by several breast implant manufacturers. The manufacturers, the major ones at least, make both types, both gel and saline implants. Both gel and saline implants share a silicone outer envelope. It's pliable and soft, but it forms the outer membrane. The difference is what's inside the implant. A saline implant is filled with water. There's a dash of salt placed in it just to equal the body's concentration. A silicone gel implant is filled with a silicone gel polymer. It's a clear gel similar to maybe the consistency of Jell-O. They both have pros and cons, and one implant may be better for a particular individual and the other implant better for another. In general, silicone gel-filled implants are known to be softer than saline implants. That does not imply that saline implants are hard. They're still soft, but they're a wee bit firmer than the silicone gel implants. Probably the biggest reason why some women choose a silicone gel-filled implant over a saline implant is that there's a downside to saline implants, particularly in lean, thin individuals. And that's with a saline implant, there's a fairly high chance that one would be able to feel the implant with one's fingertip somewhere on the breast, usually on the lower outer aspect of the breast if the implant is placed under the muscle. Some women do not like that at all. Other women doesn't bother them. But in general, a silicone gel implant feels softer, a bit more like a larger natural breast would feel, and also there's less chance of being able to identify the implant with one's finger. So, what are the pros of saline implants? Well, saline implants do have their pros. One, the incision or the scar to place a saline implant is smaller than a gel implant. Saline implant scar is about that long, and a gel-filled implant can be a bit longer. Scars are permanent. That's something to consider. Also, saline implants can give a woman, if she so desires, more fullness in the upper aspect of the breast. We call that superior fullness. Saline implants can sometimes achieve a better shape to the breast. Other times, saline implants can help lift a breast if a breast is down a bit. I think that's true in certain individuals. A woman who has sufficient body tissue, has some fat on her body, maybe she has a B or C cup breast to start with. Often you can't tell the difference between a saline and a gel. During your consultation, and if it's in my office, when we have our consultation, we spend a long time talking about the differences and all the different choices one gets to make with implants. An important one is choosing saline versus gel. We also discuss sizing, implant profiles, shapes of implants, and also the covering of implants. All these factors are very important in achieving a successful outcome. Please, if you have any further questions, or if you'd like to set up a consultation, don't hesitate to give a call. Thank you.